Christ Community Health Services Augusta is a nonprofit, faith-based primary care center. We have 5 providers, 4 physicians, and a nurse practitioner. We see mostly low-income patients from the central Savannah River area, which includes mostly Augusta, Georgia patients. We see approximately 70% uninsured, and the majority of the rest are made up of Medicaid and Medicare patients with a small percentage of private insurance.
The rich trails of thick refurbished planks of natural hardwood floors, which date back almost 2 centuries, and bold crown molding adorning the walls, makes Christ Church Community Health Services Augusta look more like an old Victorian mansion than a place of care for the poor. When Dr. Robert Campbell, the co-founder, first envisioned answering his calling to provide care in one of Augusta's most impoverished communities, he never thought he would be doing it in perfectly painted exam rooms, some highlighted with antique fireplaces framed in classic wood craftsmanship. But his even-keeled humility and devotion to his work as the co-founder of the practice offsets what can be misconstrued as a lavish decor for providers.
Both Dr. Scarborough and I, my co-founders, trained up at University of Tennessee in Memphis in a large FQHC called Christ Community Health Services in Memphis. We both had a vision for starting a faith-based primary care clinic in Augusta, Georgia, and opened our doors in November 2007.
Dr. Russ Ayers, a family physician at Christ Church, acknowledges that the combination of his faith and his devotion to his craft is why he chose to work at this practice.
I became a Christian in medical school, and my eyes were open to God's love for the poor, and then I always felt called to serve the poor. I felt that calling through mission trips overseas, and I originally thought that I would go overseas and serve after my family medicine training, and then heard about opportunities here locally in underserved populations like here at Christ Community in Augusta. And
the current main location has a storied history that concludes it serving as the first city hospital in Augusta in 1818, when its primary responsibility was caring for the sick and poor in the area. In the 1820s, it became the Medical Academy of Georgia and evolved into the Medical College of Georgia, which is now the Georgia Health Science University. As the school outgrew the space, it moved and the facility was converted into a 43-room widow's house, which it served as until 2003. So through effective fundraising, Dr. Campbell was able to convert one level of the 3-level facility into a 12-room community health center. As Dr. Campbell planned to move his team into the space, an electronic health record system was a no-brainer. He knew he didn't want to shortchange patients in any way, so he went with what he felt was the industry standard.
Electronic health records have been a cornerstone to our success and what we consider our ability to provide good quality primary health care to underserved populations in Augusta. As most studies show, electronic health records really ups the quality of primary health care when they're applied in this setting.
Most within his young team of providers knew nothing about electronic health records. Much of that is due to the fact that Dr. Campbell used a large portion of the practice's startup money to purchase its electronic health record system. They chose eClinicalWorks for several reasons.
It was very ergonomic. It was easy for us to use. And right out of the box, it was easy for us to move around the templates and move around the patient encounter. We also chose it because we knew that several large FQHCs had adopted eClinicalWorks and that their practice management software was FQHC friendly, and we wanted to move in that direction to become an FQHC. We also chose it because it was affordable. And it was very competitively priced.
The early adoption of electronic health records has allowed for Christ Church to closely monitor the progress and the benefits of the tool.
We've seen increases in the percentages of hemoglobin A1Cs tested in our diabetics. 20 years ago, there'd be no way for me to have any idea of how well we were taking care of diabetics as far as meeting goals for hemoglobin A1Cs, or even seeing if we had checked hemoglobin A1Cs in our diabetics, seeing if we had done lead screening in infants.
Campbell encourages his team of providers to live in the community in which they are working because he believes it's essential in earning the trust of his patients.
This has been a real blessing for this community. This community was on a downward spiral. We have several public housing communities surrounding us, and then quite a bit of private residential, a lot of rental properties around this community. There are no health facilities in this neighborhood, and so we thought this was a good place to put a clinic and to put our people. We have this philosophy in our clinic that almost like a small town physician, that the physician and the providers should be known by the community that they serve, and they should share in the experiences of the community that they serve. And so we've encouraged our physicians as they've come on staff to move into the neighborhoods where we found clinics. And we have currently 3 physicians and our office manager living in this community where we have the clinic. And it not only helps our physicians and our administrators to see the needs of this community through the eyes of the community, but it helps the community build relationships and build trust with our providers, which is the cornerstone of a good therapeutic relationship with patients.